Well, hello and welcome to all of our viewers here today. I'm Fiona Lang Sharp, IBCLC Director of Communications and one of the MCs here at Gold Learning. Well, here we are once again sitting down with one of our very special guest speakers for this year's Gold Lactation Online Conference. Welcome to Carolina Ochoa. It's so good to have you here today.
I'm so excited to be here. This has been a dream of mine, and it just keeps fulfilling itself.
Well, I mean, it's a perfect fit, I have to say, for this particular presentation. And I'll just tell everybody what you're going to be talking about: translating knowledge into practice, creating effective lactation care plans. And of course, you're going to be talking about putting a plan into place for pumping, how to create a state-of-the-art pumping care plan without overwhelming your patients. So boy, I know there's going to be a lot in this presentation, and I'm sure you thought about all the things that you wish you could put in as well, Carolina, but it's a big topic that you're going to be presenting on. But before we get into that, I would just love it if you could introduce yourself a little, tell us about where you are in the world, because we've got all of of course, our delegates listening in from around the world, but tell them where you are and what do you do right now?
I am in California in a city called Redlands, just around an hour and a half away from LA, just to kind of place it on the map. I'm a mom. I'm a boy mom. I have two boys, so everything else in my life is pink because I need to compensate. So right now, I do have my private practice. I do have a company, and I also work part time at a pediatrician's office.
Mm,
So I get to see babies in different phases of life and in
mm.
different clinical settings. So this is what I love the most, that I get to see all these different stages of breastfeeding.
Oh, wow. That's fantastic. That gives you a really varied kind of practice as well, which must be wonderful. Now, I know you're talking about pumping during this presentation. I did want to talk a little bit about the actual subject and maybe sort of get an understanding of how many parents you're talking to about pumping. Is it you find that every parent has questions about it these days, Carolina?
Absolutely. Literally, as soon as they find out they're pregnant, they're bombarded with all sorts of advertisements for pumps, for products. So, of course, as soon as the need was created, then we get more and more questions. But as the need grew and as insurances started to cover breastfeeding supplies, I
Mm-hmm.
feel that education on pumping has not picked up enough compared to all these new products that started to be released. So I definitely see the uptick in parents needing support with pumping, needing support with exclusive pumping, and then that support being quite limited to these parents seeking help.
Yeah, it's a very interesting area of our line of work. Of course, I'm an IBCLC as well, because I feel like for the longest time, or it seemed like for the longest time, there were very few choices. It was sort of standard, and now there seems to be a lot of choices. I do really feel like, as a lactation consultant, I need more skills, more education, as you mentioned, in really how to inform the client, because I feel like there's a missed opportunity here. We get lots of complaints about how pumps are not working or how, they don't feel good. And then of course, we see the damage that's associated with them as well. So I think you're right. You must see this a lot, that the education level just doesn't meet the actual product yet. And then, of course, the
Mhm.
consumer is the one that suffers. So, what have you been able to do or see in your practice to sort of try to get things up to speed, so to speak, in this area?
So for all my prenatal clients, I actually ask them to bring their breast pump if they already have one. So
Mm-hmm.
even before the baby's born, we go over how to use their breast pump. We try to size them for proper flange sizes, so they feel prepared if they do have to pump, that they'll be ready. And I do sometimes hear from other lactation professionals, like, let's not ruin a good thing. We don't know if they're going to need a pump. How about we instead not talk about it and talk about it when it's needed? But honestly, it is going to happen. 90% of my patients return to work
Mm-hmm.
um, after 6 weeks, some of them even earlier,
Sure.
and that pump will be a part of their life. We really need to give due diligence as far
Mm-hmm.
as education to these families. And this is what I started doing, just prenatally seeing patients, helping them understand their pump better, sizing them for flanges,
Mm-hmm.
and just kind of letting them know as they go forward what to look out for, that
Mm-hmm.
things that we put in place,
Mm-hmm.
they might need a little bit of changing, a little of tune up,
Sure.
because everything is so fluid in lactation and pumping.
Absolutely. Yeah. You touch on quite an important point there about the conversation that we've often heard as professionals about not wanting to step in or not crossing that line of introducing equipment or talking even about equipment too soon or too early because it might become then a barrier. But in actual fact, you're seeing the reverse, because if we don't talk about it, then we're sort of, we could potentially be withholding information or keeping it,
Hmm.
education back, which then in the situations that you have seen, that doesn't work out, because you see a lot of families go back to work early. Now, for countries perhaps like Canada or the UK and other countries around the world where we have mat leave is longer. So this is something I'm sure you are very familiar with. But I would agree with you. I see the problems creep up very quickly, when it comes to pumping. So even with clients who are off work, all of a sudden they find themselves in either a decision making, so wanting to make a decision and not knowing what to do, and of course fatigue and all the other things, the overwhelming factors that play into having a new family and trying to balance that out. So I feel now even my point of view has changed, Carolina, in terms of I'd rather do an education session on how to utilize and use a pump correctly, when and how, so even if you did have an extended maternity leave or parental leave,
Hmm.
it might be different for you. So I think that has to play into supporting families in a more appropriate way. Is that kind of where you're lending to right now?
Absolutely. And that goes both for pumping and bottles. So I
Mm,
always see it, I always see it in a very funny way, but it's like teaching teenagers about safe sex. We can
right.
choose not to talk about it and let them find out on their own on the internet, or we can actually teach them how to do it safely, how to do it properly, and this way they actually might have less of a chance to get pregnant if
Yeah.
they don't want to. So this is something that we need to do, and we need to educate and then really let the parent choose.
Mm,
We're not gatekeepers of information. We cannot just cherry pick information that we
right.
want to give to our patients because
Hmm.
it fits with our beliefs.
Sure.
We have to give them the information that we do have that is available, and then together with that patient work on what do they really want, what really matters for them, because it might
Hmm.
be completely something different than what matters and what is important to us.
Ooh, I feel like this is going to be a hot topic, and I think we're ready for it. I think we want to take, we want to take our lactation practice to the next levels. We want to be up to date, and I think that we need to do that together. I think that this conversation is going to be really important. Now, you're going to be educating us, of course, about putting a plan into place so it doesn't overwhelm our clients. But I think equally we can value collaboratively having a conversation about this. And I know you're going to be available in our forums as part of this particular package. So you're actually going to be pre-recording a session, and it's going to be part of the add-on. And of course, that featured add-on, which is translating knowledge into practice, creating effective lactation care plans, is going to be available immediately when you register for this conference. So that's something you need to know, that this is going to be available right away. And Carolina will be available to you in the forums to continue on this conversation, which I think is so important, because I know it's it's hard for people to shift gears and try to figure out what the values are, but I think that you're absolutely right. We're not gatekeepers of information, and it's just knowing how and when to balance that all out with all the other things, of course, clients really want to know as well. So that's going to be wonderful. Wow, thank you so much. I feel like we could go longer, but I know we just have a little time today, and I know you're going to be available throughout the conference, and so please check in with Carolina in the forums and say hi to her and stop by, ask any questions. She's going to be sharing a lot of really great information. I've had the opportunity to sit down and have some of the inside scoop into the presentation, of course, with her already. And I know that you're going to find this information so, so valuable. So thank you once again, Carolina, for being with us here today.
It's absolutely my pleasure.
Yeah. And thank you to all our viewers. You can pop comments and questions down below. If you've got something right now that's burning and you want to know more about putting a care plan into place for someone who is pumping, then this is your chance to put it in right now. We'd love to hear from you. And of course, you could register for this package. This is part of our add-on packages at our Gold Lactation Online Conference this year. Go to the website right now, goldlactation.com. That's right. You can sign up and register for this, for the full conference. And then you can add this specific package on. I know you're not going to want to miss out on it for sure. Well, thank you so much. It's been great having you here today. We'll look forward to seeing you online, Carolina. And of course, to all of our delegates listening in, thank you for joining us once again. Have a wonderful rest of your day. Bye-bye for now.